Why call a mental health crisis line? Have you ever found yourself in a moment of overwhelming distress and wondered where to turn? If so, calling a mental health crisis line might be one of the best decisions you can make. When someone is facing a mental health emergency, such as intense emotional pain or thoughts of self-harm, these lines become a lifeline. They offer immediate, free, and confidential support from trained counselors who are available 24 hours a day, 7 days a week. One of the key reasons to reach out to a crisis line is for immediate emotional support. When feelings of despair or hopelessness take over, it can be hard to see a way out. Crisis counselors are there to listen actively and provide comfort during these tough times. They can help you feel less alone, which is so important when you are struggling. Another vital aspect of calling a crisis line is safety planning. Counselors can assist in creating a personalized plan to keep you safe. This includes identifying warning signs that may indicate you are in crisis, discussing coping strategies, and listing supportive contacts you can reach out to when needed. Having a plan can make a big difference in managing overwhelming emotions. Crisis lines also serve as a bridge to other resources. If you need further help, counselors can quickly connect you to emergency services, mental health professionals, or community support systems. This can be especially helpful if you are unsure of what steps to take next. Confidentiality is another reason to call. You can speak openly about your feelings without fear of judgment or breach of privacy. This safe space allows you to express your emotions freely, which is essential in moments of crisis. Accessibility is a significant advantage of crisis lines. They operate around the clock, meaning help is available whenever you need it. Mental health crises can happen unexpectedly, so having a resource that is always there can provide peace of mind. In situations related to depression, crisis lines often become the first point of contact. They can help prevent escalation to self-harm or suicidal thoughts. This initial support is vital in guiding individuals toward professional treatment pathways, which may include therapy or medication. It is important to note that crisis lines differ from warm lines. Warm lines offer support during difficult times but do not focus on urgent situations. Crisis lines are specifically designed for emergencies requiring immediate intervention. Practical applications for calling a crisis line include reaching out when you feel unable to cope with depressive symptoms, or if you are worried about a loved one showing signs of a mental health emergency. They can also serve as a first step before seeking longer-term mental health treatment. In summary, calling a mental health crisis line during a moment of distress can provide essential support, reduce feelings of isolation, and guide you towards safety and recovery. If you or someone you know is struggling, do not hesitate to reach out. Help is just a phone call away.